Patrick Shields radio stations across the state of Michigan. We'll be joined by the Oakland County Executive Al Brooks Patterson a little bit later in this program. You'll remember that he was critically injured in a car crash August 10th, was in a coma, has broken bones, and his life is still affected by it. He will talk with us about the state's auto no-fault law. It's front and center now that Rick Snyder and some of the members of the legislature want to, quote, reform, end quote, the no-fault auto insurance law. Brooks Patterson is a proponent of it, especially now having lived with what he has been through. That's coming up a little bit later. Right now in our mobile AT&T studio, if you will, here at Oakland University, John Prosser, the Vice President and Partner with Health Partners Home Care, and Dr. Owen Pearlman from Trinity Health, who is an expert in residential brain injury facilities when you stay at home. John Prosser, where do we stand now? We've been talking about this for a couple of years, really. It's been this so-called reform. And I know that you must wince when you hear the word reform attached to Michigan's auto no-fault law.
Well, here we have the finest model in America as defined by the Insurance Institute itself. It's funded by drivers for drivers. It addresses the silent epidemics that rage nationwide, which are bankruptcy due to medical bills and the horrendous cost shift to taxpayers of citizens onto Medicaid, which does nothing better than to warehouse them. These people suffer and die. So here we are in Michigan, a leader, an innovator, a front leading edge state that has decided through this legislation 40 years ago to focus on the key priority, which is the care of people that are catastrophically injured in auto accidents. Remembering this is a system funded by drivers for drivers. Now comes the insurance companies who say this is an unsustainable model, and it's a mystery for everyone because we have $15 billion in our fund dedicated to serving the needs of these catastrophically injured, and the insurance companies in their arrogance say that that's an unsustainable model, even though it's worked for 40 years, and they will not provide any substance in terms of support data that confirms their assertion that this is an unsustainable model. So in all the last 2 years, as you mentioned, we have looked at House Bill 4936 in September of 2011, which was subsequently broken down into a dozen little nitpicking bills trying to get a little bit here, a little bit there, none of which occurred. The insurance companies were unable to get the votes in the House or the Senate to actually pass this kind of reform bill. Certainly from the coalition protecting auto no-fault's point of view, we would like to see some reforms regarding consumer protection, transparency, full disclosure. And you're aware that in the fall of last year, we filed our lawsuit regarding transparency, and Judge Kennedy in the Circuit Court ruled in our favor twice. It's now at the appellate level for consideration by the justices. But even yesterday, the insurance companies upped the ante again, raising the amount that we pay into the catastrophic fund without any evidence. So the purpose of our visit to see you today is
now?
$186. I'm sorry, yeah, $186. Right?
So it went up $11.
That's right.
Mm-hmm.
And
for that, if you're in an accident, catastrophic, you're covered for life, no questions asked.
Well, that's it. We made the priority the care of the catastrophically injured patient. When you're airlifted to the University of Michigan or St. Joseph Mercy Hospital in Ann Arbor, where Dr. Pearlman is a practicing physiatrist and cares for these patients on the front line, you realize how significant it is to have this resource. And in Michigan, the focus by the legislature has been on the quality of life for people that are injured. My company takes care of people in the home 24 hours a day. Nowhere else in America is a citizen that's catastrophically injured available or able to get the availability of that kind of a benefit. So our model is all about comprehensive, compassionate care in a system funded by drivers for drivers.
So, Doctor, if this were reformed, as they say, or taken apart, changed, capped, limited, would people be able to get that kind of treatment in their home?
No, they wouldn't. What they would be able to get, Michael, is essentially the acute care, the EMS coming to the scene, the transportation to the hospital, the emergency care in the hospital, and likely the initial acute care in the hospital. But even during the acute care phase, if it was capped as proposed, they may run out of funds even during that time.
Then what happens?
Then,
Because it's a lifetime ailment, right?
it's a lifetime ailment. We're talking about catastrophic injuries, individuals with traumatic brain injuries that affect them physically, cognitively, emotionally, and behaviorally, and individuals with spinal cord injuries who are not only paralyzed, but are paralyzed with their bladder, their bowel, they have spasticity, they have many complications. And most of the people that are injured young. They're injured between the ages of 15
Really?
and 30. So we're talking about a life sentence for these individuals.
And that's because there are more accidents, car accidents with younger people,
More accidents with younger people. They tend to take more chances.
which means they have a long life, presumably.
They have a long life, and then they won't have access to what we're just talking about. They won't have access to ongoing therapies. They won't have access. They might have access for 60 visits for that first year of physical therapy, occupational therapy, and speech therapy, but they're going to have ongoing needs.
Who pays after that with a cap?
Well, with a cap, many of those folks will end up going on to Medicaid, and it's estimated if these changes are made within the first year alone, there would be a $30 million hit on the Medicaid system that's already having a difficult time funding.
And that's progressive, isn't it? I mean,
Yes.
this $30 million accumulates year after year.
Yeah.
Doctor, isn't it true that people that have more aggressive, persistent therapies are more likely to achieve some quality of life?
There's two things to consider. Certainly the people that have more aggressive therapies have more quality of life and actually have a chance to become tax-paying citizens if they have access to the appropriate therapies. Additionally, it's also been proven that early access to therapies makes a significant difference as well. And so in other states where they do not have this auto no-fault, many people have to sue for their benefits, have to wait a couple of years for the lawsuits to be resolved or settled. And by that time, the window may have passed for them to have their best opportunity for a greater outcome.
As if the family's not in enough strife at that time.
Family's in a lot of strife. And so what happens is in these other states where there aren't opportunities to care for these people at home and get support for it, they have to quit their jobs to take care of their family members. So it puts the whole family, in jeopardy of bankruptcy.